Hi, good morning. I hope you all are doing well in your life. Okay, today the topic is about that vitamin in which all of the population of the world is 70 to 80% deficient. And guess what? What's the name of that vitamin? It's B1. It's thiamine. So B1 thiamine is a water soluble vitamin. So it doesn't stores in the body like vitamin A, vitamin K, vitamin D, and vitamin E. These kind of vitamins stores in the body because they are fat soluble. So thiamine B1 is a water soluble like other B vitamins like B2, B3, B6, B9, and B12. All right. So today we're gonna discuss about B1 thiamine, all of its early symptoms, severe symptoms, causes, and its natural treatments, even if you are diabetic. All right. So number one, we're going to discuss about the early symptoms of B1. It's fatigue, irritability, and loss of appetite in the early stages. But in the more severe deficiency of B1 thiamine, it's dry beriberi and wet beriberi. So dry beriberi can lead to neurological issues like neurological issues, okay, nerves issues. So what will happen that you will have lots of numbness and tingling, the tips of your hands, in your feet, mostly over there, all right? And then you got the muscles atrophy, like the reflexes won't be that like easy to go because you ran out of energy. And memory confusion, difficulty with concentrating, like difficulty in walking, like like it's a buzzing sensation. And in wet beriberi you will have like your heart will be pumping like circadian rhythm, shortness of breath because your breathing will be very very slow and your heart would be pumping. And then you will have lots of confusion and gastrointestinal issues. You will have stomach issues because all of the severe deficiency of B1 thiamine is connected to your digestive system. Your nerves are connected to your digestive system. And when you will have all of these symptoms, so your digestive system won't work properly. Seriously, and you will have more deficiencies because if your stomach is not making enough acid, the bile of your liver and pancreas are not flowing properly, so you will have lots of other issues in the future if you don't cope with this as early as possible. All right. So we don't want like extra depression and anxiety because already it's a very like depressionful, the world we are going through it. So you will have all of that neurological problems. All right. So what are the causes of the depletion of B1 thiamine? Number one is chronic stress. The more you stress, the more you deplete B1. All right. Excessive use of alcohol, but in my view you don't have to use any kind of alcohol, but if you want to use it, just you can drink like once or twice a month, but according to me I will not recommend any of that to you. All right. Instead of that, you can make like homemade soda, okay, and I will show you in my further videos. All right. And excessive use of coffee and tea. You can have 1 cup of coffee, but you can't have like lots of. I've seen like people are drinking like eight cups of coffees. Are you kidding me? Can't believe it. You know what I mean? And uh, like nowadays 80-90% population of the world are eating ultra processed foods. Ultra processed, all kind of ultra processed foods, cracker, biscuits, you name it, like white flour, white rice. You can eat uh, like authentic brown rice. All right. Yeah, brown rice contains lots of B vitamins. The final part of my video is the treatment of B1. So there are two ways for the treatment of B1. Number one is from the diet, and number two is from the supplements. So you need lots of supplements up to like 4 to 6 months. So several months, till 4 to 6 months you need it to correct your B1 deficiency. So from the diet, you can have 1 cup of green peas. It contains lots of B vitamins. You can have organic wild rice or brown rice. So it contains lots of B1 and other B vitamins. You can have a B vitamin from nutritional yeast if you are not allergic to it. And you can have like 200 grams of wild caught salmon, beef liver, lamb liver, organic chicken liver. They contain lots of B vitamins, especially B1 and B12. Okay. And flax seeds, 1 big tablespoon of ground flax seeds contains 0.5 mg of B1 vitamin. Like it contains like 40% of it. So you need like 1.2 milligram from the food that I have mentioned you. And the second one is about the supplements. Okay, I have this supplement B1, which is a natural water soluble L-Thiamine from Dr. Eric Berg, and they haven't sponsored me. I'm not taking any money from them. So you can see it contains lots of B vitamins, and over here it's mentioned L-Thiamine 50 mg from garlic. So the second supplement, I have this nerve support, but this type of B1 is benfotiamine, and it's a fat soluble. So what will happen? The fat soluble will be in your like nerves for a long time. If you take like 3 to 4 months, you have to take it regularly, like 300 to 400 mg of benfotiamine. This one you can see over here. Yeah, I hope so you can see it. So you can buy online, and you can buy online from Dr. Eric Burr official website. I will share a link down in my video, down. And you can buy, if you don't want to buy from Dr. Eric Berg, you can buy from other online stores. So it needs to be like 300 to 400 milligrams. You need to take like for like at least like 3 to 4 months to correct your deficiencies. And remember, in the last, B1 won't work without magnesium. Seriously, B1 won't work without magnesium deficiency. So if you have a deficiency of magnesium, so you need to take magnesium in the day, like for example, taking like supplement form magnesium glycinate, uh, 300 to 400 milligrams. So I hope in the last that all of this B1 deficiency causes, the treatments and the severe deficiencies, early deficiencies have found you very much clear to you. And don't forget to like and subscribe my channel for amazing natural health, dietary and nutritional supplement videos. All right, it's all about your health, and think about your health. If your health is very good, perfect, so you can do anything in your life. Just remember that. All right, health is wealth is a well-known proverb.